So I'm Michelle. I work here at Horizon Health. I've been here 17 years now. So some of you, I know a lot of you out here. So we're going to start today with a little exercise. So I need you to grab your pen and flip your paper over. Any scratch piece of paper will work. So I want you to first start by signing your name. Do your signature on the paper. Does everybody have a pen? Does anybody need one?
Raise your hand if you don't have one.
Was everybody able to sign their name okay? All right, now I want you to close your eyes and sign your name again on the paper. Was it harder?
Oh,
Yeah, what was harder about it? Couldn't see it. How many of you had to think it through a little bit more? A little bit? Hoping you were writing straight. Did everybody write straight?
No.
No, a little crooked. Okay, we're going to do one more thing. I want you to close your eyes and write it with your opposite hand, your non-dominant hand.
You have to close your eyes again.
Close your eyes, yep. Some people are laughing. Is your handwriting look a little bit bad? How did it go? Can you read it? How many of you can read your name? Is it worse or better? Worse. Why is it worse? Any ideas?
Never done it before.
Never done it before. Yeah, it's not your normal. Most of people with dementia, we are asking them to do things, and we change their normal routine. It gets harder. It's harder for them because that's not the normal way they do things. How many of you have a set breakfast, certain time you get up? How many of you have a certain thing you usually eat in the morning, certain way your coffee is, and now you have a loved one, whether it be family or a caregiver at a facility, looking at you saying, no, 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 there's sugar in there. That's enough sugar in there. And you're going, this is not my norm. Not my norm at all. The other thing is how many of you felt your brain had to think harder when you closed your eyes and wrote with the non-dominant hand? Your brain was on overload, going, this isn't right. Sorry, I'm squeaking. So kind of thinking about those things. So we're going to start talking about vascular dementia today. How many of you know anything about vascular dementia?
Yeah.
Vascular dementia is one of the 80 to 90 different dementias you can get. And the reason I wanted to focus on it today is it's beginning to be more common for people being diagnosed with it. So I want you to learn today a basic understanding and have gain some understanding of the changes they go through. And I also want us to be proactive of what can we do to try to eliminate some of those chances of us getting vascular. So this is a brain with somebody with vascular dementia. The blood flow isn't going to all parts of the brain. So here, there's no blood flow. There's no blood flow up here. Certain parts of the area are not getting that blood flow because it's concentrating on going to your heart and other areas of your body, which makes it very, very difficult for people to act their normal way. Vascular dementia is 20% diagnosed right now. Out of all the dementias, only 20% of people are getting the diagnosis. More men than women. Anybody have any idea why more men than women? More heart disease often. More heart disease, more diabetes. Men are getting diagnosed with that a lot more and they have a higher chance. Usually ages 60 to 77 have a higher chance of getting diagnosed with vascular. Vascular, though, is a blood supply problem. It's all about oxygen and the blood flow in the brain. So if you kind of think, how many of you have ever had a foot fall asleep? Does it take a while for it to wake up? Yeah. It's kind of the same with the blood supply in the brain. All of a sudden, you'll be working with somebody that has vascular and you're like, oh my God, they're so off today. They're not themselves. And all of a sudden by afternoon, boom, you're like, wow, they're better. What the heck happened? Is it somebody that's taking care of them? Is it the environment? It's because that blood supply came back in. And then it came back out. And then it came back in. So it takes a little bit. First thing you're going to notice is sudden changes and spotty losses with somebody with vascular. So all of a sudden today, they're having a really rough day. And you're going, God, I wonder what's going on. And then the next day, they're all right. And then tomorrow, they're not so well. And family's like, well, you said mom was bad. And she wasn't bad when I visited. That is a lot of vascular. They'll get bad, and then they'll plateau for a while, and then they'll get bad again. Okay? It's all about the blood supply. It's very unique to the person. How many of you have had edema? Yeah. Everybody's edema is different, right? Some people get really big swollen legs. Some people get hands. It's different. It's the same with vascular. It's very different for each person. If I got diagnosed and you got diagnosed, it's going to be completely different. This group has a frequent urge to urinate. People that have vascular issues have a frequent urge to urinate because it's about the blood supply. The other thing is they neglect things on the left side. So oftentimes they start to lean. You'll see it in a chair, and a lot of times we'll put a pillow in there, and a little while later, mom's leaning again. They also lean forwards and to the left. So I take care of a woman. She always falls towards the left. We know that we need to make sure that there's pillows propped and everything because she's going to go that way. She's going to fall that way. When you place food in front of this group, they will often eat what's on the right side of the plate and not the left. And it's not because they're not hungry, they just don't notice it there. When you turn the plate, they'll finish eating. So it's very interesting with vascular, it's just turning the plate. Same thing with silverware. If you put it on the left side, they'll eat with their hands. They don't even know the silverware's there. Same thing with cups, making sure your drinks are on the right side or they'll get dehydrated if you put it on the left because they won't notice there's something there to drink. Duration. They can have bounce back and bad days. So all of a sudden, you go to visit your mom, and she is doing great. She's remembering who you are. You went garage sailing. You had a great day. 3 days later, after your brother's been there to visit, you go to visit, and mom's awful. And you call your brother out on it and say, what the hell did you do to mom? Mom was fine 3 days ago. What did you do to her? That's very normal with vascular. They're going to have really good days and not so good days. When I work with anybody that has vascular at a facility, I often tell families, let me call you when they're having a great day. Because I want you to visit when they're having a great day. And when you have days that aren't so great, maybe you need to go home and come back a different day. Because vascular is very up-down. Okay? Their mood changes. Their behavior's not the same. Dad may have been the most holiest person in the world and prayed the rosary, and now he can't stand to listen to Mass. Or Dad was very calm. He could have patience, and now he's demanding, and right now you go get that for me. That's very normal with vascular, okay? The big thing with vascular is you see emotional and energy shifts. You'll be visiting mom, having a good conversation, and she'll look at you and she'll say, God damn it, what are you doing here? Why are you visiting? Or she'll start crying uncontrollably. And automatically, what's the first thing you're going to want to say as a child? What? It's okay, and what's wrong, right? Mom, what's wrong? What are you crying over? And she's going to say, I don't know. I don't know why I'm crying. And she really doesn't. They have no idea why they're angry, no idea why they're crying. No idea why they're laughing uncontrollably at the funeral, because their emotional area isn't getting blood. And so you'll see these huge shifts because of the blood supply in that area of the brain. Best thing to do when they're in this stage is just move on. They're yelling at you, go, I'm sorry, Mom, and move on. If they're crying, say, here, Mom, here's a Kleenex. Let's go ahead and get a drink of water. Because it's very, very hard. They're not going to be able to tell you why, and they're getting angry going, well, I don't know why I'm mad. It gets frustrating. It's usually triggered by internal and external factors. Internal could be pain. If they're in pain, they're not always going to be able to tell you. They just know, I'm crying and I don't know. It could be too much noise. How many of you do not handle noise well? Yeah. And if we don't know that about you, or you don't know that about your mom, those little sounds are going to be irritating. Even the closing of those cabinet doors over here could be an irritant for them. Vascular gets very irritated with things that are going on around them. How many of you can't handle when people are chewing with their mouth open? Oh my God, those are going to be irritants for you if you have vascular. The pen clicking. All those things can be irritants for them. And if we're a kid taking care of our loved one, how many of us would notice that? I wouldn't notice that. I wouldn't notice that at all, that there's Dad, he's getting angry, and here's the little grandchild tapping his foot. That could be a huge irritant, so we have to really watch those things. The other things is alertness and arousal. They can shift suddenly, or they can be stable. So today I'm really with it. Yep, I was married on this day. My husband and I met here, and all of a sudden tomorrow, I wasn't married. What are you talking about? It'll shift a lot with vascular. They also have problems recognizing what objects are for. Very easily, this group will take a toothbrush and brush it through their hair. This is where they may start eating things that you wouldn't even think Mom would consider eating. Your pretend fruit sitting on the dining room table is now what they're eating. They don't understand that it's not fruit. It looks like fruit, therefore I'm going to eat it. I plant seeds for spring, and my vascular folks will often try to eat the dirt because it looks like a chocolate-covered donut. Nice chocolate, little sprinkle there. So really watching, they lose safety awareness, and they're looking and trying to put everything in their mouth, wondering, what is that? Okay? Big thing with vascular is strokes. Strokes, you have a higher chance of getting vascular because you're having little minor TIAs, okay? There's a left part of your brain and a right part of your brain, and they each change. The left part, it's slower. How many of you have noticed with somebody with dementia that it takes them longer to say something to you? Yeah, that's the vascular part, is affect my temporal lobe, and it takes me longer to get those words out, okay? They also have more delay in their thought and action. If you give them your hand to shake it, oftentimes they'll look at your hand for a little bit and then shake. That reaction time is longer. They have more risk of being helpless because they only know what they knew from before. I never had a walker. Now you expect me to use this walker, and for years I never had to use it. Is it going to be hard to train them to use a walker? Yeah, a lot harder. They have more fear of movement because I get dizzy when you sit me up, and when I go to stand, I'm really scared because I'm unsure of my movement. I also have more frustrations with inability. How many of you would get frustrated if you couldn't get yourself dressed? Yeah. Or frustration you can't drive. Frustration you can't reach that area in the shower. Or that everybody's yelling at you, no, 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 this is how you do things. It's very, very hard. So there's a lot of frustration. If you're frustrated, how many of you are vocal when you're frustrated? Me too. And then the children are like, Mom is so mean. No, I'm being the same person I was before. I get vocal when I'm frustrated. They also are more frustrated with dependence on people. How many of you would be frustrated if you had to depend on people? Yeah. So when you say, hey, I need you to do this, it can be frustrating. This group needs things to do that keeps them independent. If your loved one was in the home, at your house, and you were taking care of them, and they were a farmer all their life, and you had to take care of them for 24 hours, what would you have them do for purpose? Any ideas? Peel potatoes. And is it going to take them longer? Are they going to do it the way you want them to?
No.
Is that going to be really hard for you to accept?
Yes.
Yes, it is. Yes, it is. Because I can already tell you, if my husband gets vascular or any kind of dementia, I'm going to be, this is the way we fold towels. This is the way. No, 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 give it to me. What else could we have them do? Could they sort? Most farmers, how many of them tinker with their screws and nuts and bolts and everything has to be so? Could they sort those for us? Yeah, you could have your children, please bring Dad nuts and bolts. He needs something to do. How about counting money and putting money, sorting, here's the dimes, here's the quarters to take to the bank? Yeah, because most people when they get up, what is their purpose if I can't drive, can't choose where I want to go, don't have my farm work to do anymore? A lot of times they have nothing to do, and then that's when people get mad because I'm depending on you for everything. What can I give? They're more impulsive, so they do not think things through. Automatically, if somebody says something to you, how many of us think it through and who we're talking to before we respond? I do. If I'm talking to my boss, I'm definitely not going to probably say what I'd say to my husband. I'd yell at my husband, not my boss. We know we can think it through. They can't. So as soon as you upset them or something upsets them, they're going to say so. They're less aware of the impact. They don't understand that you're upset. They don't understand why you gave them that dirty look and rolled your eyes. Well, why are you mad at me? What did I do? Well, I can't say nothing. I might as well not talk. It's frustrating for them. They're less aware of body parts, especially on the left. So if you think about it, they might not wash the left armpit. They might not wash this left side. They probably aren't aware of the back side. Well, I took a shower. Yeah, Mom, you took a shower, but boy, oh boy. And you start noticing they're not washing as well. Even behind the left ear, they're not doing as well. They have less safety awareness. So, I'm sure all of you had to drive to get here, most of you, right? Or carpool. Watch when you're driving. These are usually the people that will stop at the stop sign real quick and zoom through. They're the ones not looking of how far that car is coming. Are they going to stop? How many of you worry about people stopping? We're kind of Minnesota nice around here, and we stop. Okay, you go. You go. Even though I was here for, you go, because I did not want to get hit. You go. That's what we do. They don't have safety awareness. They don't understand that, oh my goodness, this water could boil on the stove and overgo. Oh my gosh, I'm not supposed to do stairs? Really? Oh, I can make those few stairs. And all of a sudden they fall. They're more distractible though. That is a big plus to use. A big plus with them. Hey, Mom, look at this. Look what's in the paper. To get her away from holding that knife. Making lots of substitutions for this group is huge. They have less sequencing issues. What does that look like? You tell them to get dressed, and they may come out with their underwear on the outside of their clothes. You laid out their clothes for them, but they couldn't remember the order to put it on. Or they put 3 shirts on. And do you think you're going to get those 3 shirts off? No way, not happening. Making soup. They may forget the chicken broth. And there you've got these hard noodles burning on the stove because they forgot the chicken broth. Okay? And they're also less aware of the needs of others. We often have a time where we correct or try to correct somebody with vascular dementia. Mom, you hurt my feelings. Mom, that is not nice to call people fat. And what do you think Mom's going to say? Well, look at her. Isn't she fat? Don't you tell me. I am how old? I am in charge of you. Do not you tell me. It's very hard for them to notice that they're hurting everybody else, that they're saying things that are hurtful, that they're doing things that are hurtful. I talked to a lot of families and they're driving home crying. How many of you would cry if Mom said something mean to you or your spouse? Yeah, it's not easy. It's not easy. I was working with a lady the other day and she said, I just look at him and I give him a list of what I've done all day for him. I said, how's that working for you? She said, awful. He fights me. You didn't do this. And she said, we fight most of the day. Yep. I said, you're going to really have to learn to bite your tongue. And she goes, that's really hard. And it is. Very, very hard. So vascular dementia, the old term was mild cognitive impairment or hardening of the arteries. Has anybody ever heard of that?
Yes.
Yeah. How many of you have ever had somebody have that rotor-rooter done? They opened up those arteries or tried to? What happens when they do that? Does it work? Anybody have it work? My grandfather, it didn't work. It actually made him worse with higher behaviors. He never had really behaviors too much before. He was just an ornery German and Polak, and now he was a mean German and Polak. Because, again, you're messing with the blood supply. There's many variations, blockages. So we have pacemakers put in, right? We have different heart surgeries, heart replacement, right? Anybody ever have anything like that or know people that have? Yeah. It changes the flow. Diabetic medication. A lot of people are on that. Insulin. Does that affect your blood supply? So how many of you have heard of Catasil? Anybody? Most of the time when you have dementia, if you go to a neurologist, they are going to break it down for you and say, hey, you have vascular or you have Alzheimer's disease. Kind of give you an idea. Oftentimes when they get into vascular, that's where they stop. Sometimes they'll give you a better diagnosis. I wanted to go through a few of them today because the warning signs are quite different, okay? So Catasil is hereditary. It's a stroke disorder. If you have a lot of strokes in your family, this is one to give your doctor the heads up. Hey, I have strokes in my family. I'm really concerned about getting vascular dementia. This is a hereditary one. My uncles had it. My grandfathers had it. Let's look at this, okay? It affects your small blood vessels in your brain. So not your main ones, your little ones. This is where you see people, they're capable of doing something today, but not tomorrow, because it's just your little blood vessels. You're going to have more strokes, sometimes seizures, okay? Big heads up is migraine headaches. How many of us have had migraine headaches? This was a big aha for me. This is usually the first symptom, and usually they try to treat your migraine headaches, but they won't go away, won't go away, won't go away. You need to have a scan of your brain. That is where you'll see that the little blood vessels aren't working as well. There's blockage in there. The only way they can see that is with a scan. Most people that have minor migraines, it's not a big issue, but when you have major ones that won't go away, this is the big warning sign, okay? Vision problems, double vision. Blurred vision is a word, early warning sign. Flickering of lights and the floating specks. That's a big aha. I've never knew that. How many of us have had that and thought it was something else? Yeah. Often these are going into, okay, I'll go to the eye doctor, but the eye doctor doesn't know about the strokes, doesn't know about your other little minor headaches. That's where making sure we're telling the doctors everything is really important, because the eye doctor, she knows that, can go, oh, now we got something else going on. Speech. You can comprehend, but sometimes you speak meaningless sentences. You don't really make sense. All of a sudden, you're talking about something and nobody can relate. The motor. You have decreased pain sensation, so all of a sudden, you don't feel it. Your thumb's burning when you're lighting that candle. Motor disturbances. This is where they get depressed or flat apathy. You're like, Dad, come on, let's go to Coburn's, and then we'll go get an ice cream cone. Nope, I just want to sit here. Well, Dad, let's go do this. Nope, I'm fine watching the TV. Well, honey, let's go to, no. That's not because they don't want to, it's just part of the disease. It affects that emotional control center, okay? You also will see some bipolar start with this group. The average age that starts seeing these symptoms is between 20s and 40s. But guess what? Oftentimes it's diagnosed as depression, often diagnosed as stress, or, oh, maybe you're starting menopause early. This one is misdiagnosed. Also MS. They just did a study, and of the 80% of people that were diagnosed with MS that they studied, they didn't have MS. There was only 2 that had MS. The rest was CADASIL. They were misdiagnosed. How many of you have already looked at the dementia test ahead of time because you're a little worried if you're ever going to be tested on dementia? Let's be honest. We got it memorized in our head. We're going to have to remember these 3 words and come back. So you have highly educated people that are worried about their passing. And then you have people that weren't really prepared and they were under stress, and their children said, by the way, Mom, you're being tested for dementia today. And they're failing and they may not have it. Depending on who you're working with, we have a test that I give that covers all those dynamics. It doesn't look just at your mind. It also looks, can you point to your knee? Because you have to have a test that can do everything from your motor function to your alertness to everything. You're going to be able to cover those areas. Yes, there's a time that they might pass, but you also have to go ahead and retest. And that's where the problem is most places aren't retesting. Okay, she passed today. Don't you bring her back in 6 months because there's nothing wrong with her. Being that advocate and saying, no, 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 these are the things we're noticing is going to be huge. Documentation is huge. I know the neurologists that I work with, they like documentation. This has changed, this has changed, this has changed. Am I echoing?
No, I'm just going to make sure it doesn't shut down.
Oh. Is it easy? No, I'll tell you, doctors are really, really hard, and the insurance is really, really hard to make sure that people are getting the help they need. I go into the store. I do a lot of trainings, and somebody will come up to me, well, hey, Michelle, how are you? I'm like, great. We'll get a little farther, and my husband will go, well, who the heck was that? I said, I know that person. I just don't know. But while I'm at the store, am I thinking about people? No, I'm thinking about what's on my grocery list, what I'm cooking for supper. That is the least from my worries. I have to let my brain try to think, because now I just had something overloaded. And oh, now I got to come up with that name. If you're focused on who was my best friend in high school, after a few seconds, you probably can come up with that name, or at least picture the face, and then the name comes. You're okay. You're okay. If you wouldn't be able to remember that name for a while, could be stress and get it checked out, but no, you're doing okay. We're good. The next group of vascular dementia is single and multi-factor. It's caused by strokes from blood clots. Okay, big issue, blood clots. They can cause tiny TIAs. What it does, it causes the death of tissue in your brain. So it's not the blood supply, it's tissues are dying. This group will wander a lot. They walk very rapidly but shuffling their feet. That can be mixed up with Lewy body. Because Lewy body folks, hunched posture, shuffle feet, but they go slow. This group moves fast. They're on a mission. You're like, Mom, slow down, you're going to fall. This group often sees these symptoms in ages 60 to 75. That's when you're starting to see these symptoms. Subcortical dementia, very small blood vessels. They lie deep in your brain. They start developing thick walls. They get stiff and they're twisted and they restrict blood flow. This is usually these people, it takes a length of time. For example, like the fingers take forever to try to write that letter. It takes them so long to be able to think it through. It's one of the things that you'll see with this. This group gets very irritable and depressed. Very irritable, very depressed. Again, it's the small blood vessels and you have this wall. So you can't get to the area of good, happy thoughts. Not as common diagnosed either. So warning, vascular dementia also has a high risk of delirium. Delirium is a huge issue with any kind of dementia, but especially vascular. You're going to see a quick onset of, oh my God, Mom is just acting different today. She has high anxiety. She has no clue what's going on. What the heck is going on? Oftentimes, delirium comes on with a urinary tract infection or vitamin B12 deficiency, but it likes to pair up with vascular. Okay? You'll see sudden changes in them, major changes. You're like, oh my goodness, what's going on with Mom? It has periods of time after downturn where you think they're recovering, vascular does. Vascular people last 3 to 30 years. 3 to 30 years, because it's a blood supply problem. So depending upon how you're taking care of your heart, your cholesterol, your diabetes, your stroke stuff, that depends how long you're living. Okay? Same thing with COPD, if we're taking care of that. It has a high risk for depression and anxious episodes as well. High anxiety where I cannot calm myself down. I'm taking care of a gentleman right now that I'm working with a place, and he has COPD. And he has vascular. And when he can't catch his breath, he's now going through huge anxiety because he thinks, oh my gosh, I'm going to die. It's really hard to catch my breath. He's turning blue. He can't open up the airway, and vascular is really going on a huge episode right now. We have to work with him to try to calm him down, open up that airway and say, okay, it's okay, just let's take a breath. Sometimes you'll see places start using morphine. Aromatherapy works for different people. Weighted blankets work for some of these people when they're going through this anxious episodes, making sure that we're kind of watching what works for each person. Again, it's different depending upon the person. Determine first if it's a change related to vascular. So if you have vascular, we have to determine if it's vascular that's acting up, if it's depression and anxiety, or if it's delirium. Working with your doctor is going to be really important. Untreated delirium can be very dangerous because it's out of control. I just worked at a facility that didn't catch a woman's urinary tract infection. She now has delirium that is completely unmanageable. We have to have her meds re-looked at and everything because we didn't catch it quick enough. So when you notice those changes, making sure we get it treated. Excess for pain. People with dementia aren't always able to tell you where the pain is. If we have a headache, oftentimes they're not able to tell you. They may rub their head. They may just be wincing, or their eyes will get tighter. Look for possible infections. Again, we talked about urinary tract infections. Psychosocial issues. Dehydration is a big one. A lot of people that have dementia don't drink. They don't know when to take a drink, and they get dehydrated. O2 stats as well. Are they getting enough oxygen? Again, we're dealing with blood supply. Are they getting enough oxygen? A thorough behavior history is huge. Why would a behavior history be really important for a doctor? Because what?
Things change.
Yeah, things change, but also how you react to things. So I'm a fighter. I've always been a fighter. I will be a fighter till the day I die. So if I'm yelling and screaming at my children because they're telling me what to do, that's not delirium. That's Michelle. And that's a really important thing for doctors to know, because all of a sudden they're like, well, mom is doing this. And the doctor goes, well, delirium. No. Michelle's always done this. Making sure you have a really good description of, this was what my mom normally did. This is what she's doing now. Because there is a change in what's going on. Also access for new onset or worsening of conditions. All of a sudden you notice dad's more out of breath. He's having more edema on his left side. He's having dizziness, blurred vision. All those things are watching. Keeping good records is important. Because if you notice at the beginning of the month, they're doing this. Okay, is there something that changed? Did they get an up in medication? Could it be that? Could it be that the environment, all of a sudden you notice that the neighbors moved in, these loud teenagers that are playing music at all hours of the night? What could it be? Also access for med changes or side effects, like I taught. A lot of meds have side effects that can hurt people with vascular. A prime example of medications is Aricept. Anybody know anything about Aricept? Aricept is given usually for people with early onset dementias. They do not tell families that, by the way, when we put mom on Aricept, guess what? Her taste buds are going to say, no, you don't need to eat. And mom is going to refuse to eat and lose weight. We have a lady we just took care of. She lost 28 pounds. Took her off Aricept, and guess what? She's eating, walking around. Is she a little bit more confused? Yeah, because Aricept just masks the symptoms of your memory loss. So she's walking around going, hey, where do I go? But she's eating. She's not starving to death. If it looks like depression or anxiety and anxiety can be treated. It can be treated. It's not a life sentence that, oh my gosh, we can't do anything. Dad's just going to be depressed all his life. Many people that have depression describe themselves as having memory problems. They're tired and have no energy. Oftentimes, it's depression and something that they can deal with. Look for changes in appetite, sleep, how they take care of themselves with depression, and please get it checked out. If it looks like vascular, explore the possible causes of change. Could they have blockage in their heart again? Could their COPD be acting up? Is their diabetes off? What is the risk factor? What's going on? Explore what others know and believe about this person. Get as much information as possible. You need to know, hey, I'm having more edema here. You know, it's been a while since my heart's been looked at. What's going on? Is it just that I have blockage in my heart that's preventing the oxygen to my brain? Because my blood's all going here, working hard. Determine the stage and level compared with support available. What you're looking at is, what can we do? Is it worth the risk for me to have my blockage taken care of in my heart? What are the risk factors? And asking those risk factors. What are the risk factors if you're going to go in and do an angiogram? What could happen? And seek consultants. Get a further assessment. Make sure everything matches and you take things seriously and look at everything. Screening helps most people if it's done regularly. So making sure you check your cholesterol levels, making sure you check for diabetes, making sure you're watching your sugar intake, making sure you have stress tests done. Those are important. Important is make sure of, okay, I was here and then I was here. For those of you who've been to my trainings before, most doctors, when you go in and say, hey, I'm noticing something's going on with my brain, it's just not right. How many of your doctors know what your normal brain can do? Yeah. Most of them, I mean, my doctor doesn't know, oh, hey, Michelle, her memory is this way. So when they do those cognitive assessments, it's not very accurate because they don't know what your brain was doing before. So now that you have a healthy brain right now, going to someone you trust and saying, hey, will you do me a favor? Please test me on how many animals I know in a minute. And at 44, I can name 32 animals in a minute. At 48, I can only name 12. Do we have a problem? Yeah, and be an advocate for yourself, because there's no doctor out there when you go in, they don't see you regularly to go, oh, hey, your brain works this well. Being an advocate for yourself is huge. So there's different screenings. One is doing a screening with your family member. Do you know if they have problems with judgment? Does your family member show less interest in hobbies and activities? Now, just because you get a yes to any of these answers does not mean automatically dementia. These are flags. Why does he have less interest in activities? Oh, his brother died. That makes sense, okay? Does your family member repeat the same things over and over? Does your family member have trouble learning how to use a tool, appliance, or gadget? Does your family member forget the correct month or year? That's a big one. Does your family have trouble handling complicated financial affairs? Does your family member have trouble remembering appointments? Does your family member have daily problems with thinking or memory? These are kind of ahas. Watching if they changed from last week, a month ago. How many of us recheck? I will tell you, I work at the Harmony Houses, and I'm a big believer in going back 3 weeks from now and checking everybody and seeing what level they're at, because can it change? Yeah, and if it's changed, or is the dementia going quicker? Yeah, we got to kind of keep an eye of where people are at, because how they're acting is going to be huge. The next one is the animal fluency. This is every 6 months or when something changes. I have a stroke. I have a fall. Naming animals in 1 minute. Now, people that have middle stage dementia, are they going to be able to just name animals without a cue? If I look at them and say, name some animals, they may look at me a little odd and go, And if I say, name some animals on the farm, I'll get cow. Then they'll think a little bit, maybe a chicken, or they might go cluck, cluck. Those later stages, that's where you're going to get. Early stage, they might need a cue too. That's important to write that down. Mom needed a cue to get started. 4-legged animals. Animals that are in the jungle. Our healthy brain, do we need cues? No, we'll be able to come up with animals like that. We may repeat ourselves, but this is where you can compare where you're at, okay? The other one is clock drawing. I'm not a big lover of this one. I don't like counting backwards either because I would fail. But a clock, you can give them a big circle on a blank sheet of paper. Ask them to draw the face of the clock and put the numbers in. Now, if the numbers aren't exactly where they're at, where they're supposed to go, could we have some issues? Yeah, if you ever want to look, I didn't bring them today. Vascular dementia, where they place things, remember I said left side's a struggle? All the numbers start to go on the right side of the clock. Watch for construction skills and the outcome. Ask them to put the hands on 245 and watch where they place things. That's a big aha for vascular, where they place things. Frontal temporal as well, there's a difference in this clock. That's why they do the clock drawing of where people put the numbers. It's not so much, is it right or wrong? It's where they place them, you're able to tell sometimes the dementias they're having. Functional performance. This is where all these tests are important, and you kind of look and go, oh God, this is a lot of tests for mom. It's important because we're testing all levels of the brain. Because could the brain just be affected right here? Yeah, then that person has no filter. They're just going to say, you're ugly. Who's going to call them with dementia? No doctor's going to say, well, she just called you ugly. She has dementia. No, that's why all these tests are important. But functional performance, are they safe? Do they know how to use this? Compared to what they normally were able to do. Can mom put her chicken soup together? Does she know what temperature to put that on? This is a CT scan. This is where the dead cells are, is the white spots. You're kind of asking. There's the dead spots. Shows many strokes. That's where the stroke's affected. Latest thinking about vascular treatment is there's a lot of similarities with Alzheimer's disease. They match up a lot, and sometimes people are getting misdiagnosed. The big thing we need to look at is managing blood flow issues carefully. Watching for depression, anxiety, and managing chronic conditions. Obesity, diabetes, alcohol, and drug use. That's a huge one. Sleep apnea. The same thing with cardiac or respiratory problems. So what can we do? Mental activity is huge. Do we use all of our brain every day? If you haven't figured out, I hate math. I hate formatting things on the computer. I'm not tech. I can talk my way through anything, but you give me something to type up and I hate it. I have to do those things, though, to keep that part of my brain active. So on my way home, I usually count cars, count garage sale signs too, and stop. But you have to be able to use all parts of your brain. So how are you using math today? Maybe it's counting cows as you're driving, going for a ride. Or maybe it's counting how many letter A's are on this page. But how are you using all parts of your brain? If you're not a big reader, read a little article. If you haven't written today, make sure you're writing your name, because we need to use all those parts of our brain. Aerobic activity. How many of us are exercising regularly? Good. That's a big push right now. Big push. Because the more we're active, the more our heart is working. We get more oxygen in that brain. But staying active, even when you're sitting here. I have a tendency, I can't sit still, so you guys see me walking around here, but even kicking your legs at the desk is important. Making sure you get enough vitamins E and C. Those are really important ones for vascular. Making sure that those levels are good, okay? A heart-smart diet. How many of us are doing that? Good. Watching that salt. That's a big one. It's a hard one. Omega-3 fatty acids, watching. Lowering our weight. Not smoking. Even those wonderful vapes that are out there. They are really doing studies on those with vascular dementia right now. Okay? Getting enough sleep. How many of us get 8 hours? It's important. Important to get the 8 hours of sleep. Avoiding head injuries. A lot of people that have head injuries have a higher chance of getting vascular dementia. Okay, so those people that played football, people that boxed, you're seeing a lot more people, hockey players. De-stressing. This is a big one. How many of you worry about everything? You have to let some things go because it puts overload on your brain. And all you're thinking is about, oh my God, I got this to do. I got that to do. Oh my God, my husband folded the towels wrong. I got to go in there and switch that around. You have to find a way to let some of that stress go. One big thing they're trying to push is people journaling. Write it down, let it go. Write it down, let it go. One, we're keeping our brain active. Two, we write it down and say, let it go. It's not hurting anybody, let it go. Lowering cholesterol levels is huge. Watching for anti-inflammatory drugs. They are really watching how many you're taking and what they're doing to your body. Big studies out there right now, so kind of watch for those. But they are really not liking them with vascular dementia. They really want you to be making sure you're not taking too many. Staying socially active. Getting depression treated is huge. Control your diabetes is huge. Okay? We talked about that. Spiritual involvement. Minimizing risk. Is it a risky situation they're in? How can we make it less risky? Is it challenging? And reducing anxiety or distress. I get very anxious. I worry about a lot. I have to let it go. It's a big deal. Let it go. Again, my training is part of a grant. I work with Teepa Snow, so that's one of the reasons why I could train today. This is my phone number. It's for upstairs at Pierce Harmony House. That's mainly where I'm at. All right, thank you very much.